So I'm Ruvinda Jayawardena, and I'm with the HISP Sri Lanka, and I'm working as an implementer. And also I'm a specialist in health informatics. With the Climate and Health Project in Broad, we are working with three main use cases. So it's an emergent study as well. And there are lots of areas that we can investigate and do research and get useful insights. But the initial three use cases included the climate association with the nutrition trends. And then the second one is with the air quality and how that affects the respiratory diseases. And the third one is how the vector-borne diseases changes with the climate. So those are the main three things. And so initially we are making progress on two main use cases. One of them is the nutrition-informed surveillance, and then the other one is the air quality and how that affects the diseases of respiratory. If you go ahead with the nutrition surveillance, it is something, I mean, not everybody will not think about a relationship with the climate and the nutrition initially, but we have literature surveillance, literature survey, and there are multiple climate associated relationships with nutrition. And and Sri Lanka also have a good surveillance system in the maternal and child health surveillance. And so with the data availability and with the newest integration of climate applications to the DHIS2, we had the opportunity to investigate this. So surprisingly, we found many associations. And so as you can see, there are some association with the air temperature and the percentage of under 5-year-old children with stunting. But of course, it's just a correlation that we have observed, and we have to back it with evidence from the literature as well as from the subject matter experts. Our findings have suggested that nutrition is affected in short term and also long term. So in short term, it's mostly due to the crop yields and also the fisheries, how those can be affected, and also the supply chain disruptions that can ultimately increase the food prices. So it's not a direct link between these two, and it's more of a multiple variables coming in between. So although we see a relationship, we have to add more variables and make it more scientific. Because we have obvious relationships, we had the opportunity to go ahead and check on with the modeling as well, and we have some promising results as well. So we could have some promising predictions towards how the nutrition status will be within the next 3 months for certain areas, and I think that's really surprising as well. So the next steps will be that since we have already built up the climate variable integration, and we have all the support from the subject matter experts as well, and we expect to incorporate other variables which are not climate related as well, so such as the food prices and also certain other things with the satellite images that can reveal many other insights like the NDVI. So these things can be incorporated into the relationships and then go ahead with better modeling and also with research as well. And for this latter part, we would also like to implement this in the lower levels. So at the moment, we are having all these climate-induced observations and the dashboards implemented at the district level, which can be viewed by the district level coordinators and all. But we expect to get this to the lower down for the community health workers to be used, because they involve in so much of other work. So if they can be scientifically guided to prioritize their work, and so if they are going to know that they will be having a sort of a food shortage shortage and there will be a risk of malnutrition, they can act before that happens. So that's something that we are really looking forward to. And yeah, and we hope to make a good impact to that. We are not limiting our use cases to the nutrition, and we are having significant progress and in the air quality research as well. We expect to collaborate with the other in-country organizations who are interested in the climate and health, like the Planetary Health Alliance as well. And we would like to proceed with a much broader and a much scientific basis for our research and make it towards the actions as well. So I think anybody who is willing to collaborate with us for the research and also with insights towards how the research can guide towards the actions as well, maybe the other HISP groups as well, and also the other in-country ministries or whoever is interested to collaborate with us to proceed the research and also to get insights from our work as well. We had the support from the Ministry of Health and then the Family Health Bureau to collaborate and to proceed with the research and all. But the other use case we had, that's with the air quality and the respiratory diseases, we really don't have the technical expertise to proceed with that. So we had a really good collaboration with the Cicero and who's doing all the modeling and all with the air quality. So it's initially it was a little bit of a challenge because collaborating all these stakeholders, both in country and outside, and they have a bit of a, excitement and also not sure about how the things will progress on because we had a rich data set of individual data and which can be having some privacy concerns as well. So initially we had many discussions on what kind of data will be useful to proceed with the research work. So we had a collaboration with the organization that's responsible for the collection of air quality data in Sri Lanka. That's the National Building Research Organization. And we had data set that can be useful for refining the satellite images that's with the Cicero. So data from here mediated by us and transferred to the Cicero and their technical workout will generate more insightful maps. And then the health data and how health data can be modeled with the air quality data. And that involved several other parties from the ministry where the electronic morbidity and mortality registers are maintained. And with the health data, they are a little bit how this will proceed and will it really be a benefit to us. And so we had to clarify all these doubts with them. And I think with the coordination from the HISP Sri Lanka and from the University of Oslo as well, we could reach to a good agreement and a good mutual understanding. And we are proceeding towards good outcomes already.